What is depression? Strategies you need to know about depression. Hello, welcome to my channel. In today's video, I will tell you about major depressive disorder. But before we start, please subscribe to my channel and hit the notification bell. Thank you. Depression is a mood disorder characterized by persistent sadness and loss of interest. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. It is also known as major depressive disorder or clinical depression. You may have difficulty performing routine daily activities, and you may feel as if life isn't worth living. Depression is more than just a bad mood, and it isn't something you can snap out of. Depression may necessitate long-term therapy. But don't be disheartened. Most people who suffer from depression benefit from medication, psychotherapy, or both. Symptoms. Although depression can occur only once in a lifetime, most people experience multiple episodes. Symptoms occur most of the day, nearly every day, during these episodes, and may include sadness, tearfulness, emptiness, or hopelessness. Rage, irritability, or frustration, even over minor issues. Loss of enjoyment or interest in most or all normal activities, such as sex, hobbies, or sports. Sleep disturbances, such as insomnia or excessive sleeping. Tiredness and a lack of energy make even minor tasks difficult. Reduced appetite and weight loss versus increased food cravings and weight gain. Anxiety, agitation, or agitation. Slowing of thought, speech, or movement. Feelings of worthlessness or guilt, ruminating on past failures, or blaming oneself. Having difficulty thinking, concentrating, making decisions, and remembering things. Suicidal thoughts, suicide attempts, or suicide are all common or recurring thoughts. Physical issues that are unexplained, such as back pain or headaches. Many people with depression have symptoms that are severe enough to interfere with daily activities such as work, school, social activities, or relationships with others. Some people may be generally unhappy or miserable without knowing why. Common depression signs and symptoms in children and teenagers are similar to those in adults, but there may be some differences. Depression symptoms in younger children may include sadness, irritability, clinginess, worry, aches and pains, refusal to attend school, or being underweight. Sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping excessively, self-harm, loss of interest in normal activities, and avoidance of social interaction are all symptoms of depression in teens. Symptoms of depression in older adults. Depression is not a normal part of aging and should never be dismissed. Unfortunately, depression in older adults frequently goes undiagnosed and untreated, and they may be hesitant to seek help. Depression symptoms in older adults may be different or less obvious, such as memory problems or personality changes, aches and pains in the body, fatigue, loss of appetite, sleep problems, or loss of sexual interest that is not caused by a medical condition. Wanting to stay at home rather than go out and socialize or try new things. Suicidal thoughts or feelings, particularly in older men. When should you see a doctor? If you are depressed, schedule an appointment with your doctor or a mental health professional as soon as possible. Talk to a friend or loved one, a healthcare professional, a faith leader, or someone else you trust if you are hesitant to seek treatment. Causes of depression. It is unknown what causes depression. A variety of factors, as with many mental disorders, may be at work, including differences in biology, Depression appears to cause physical changes in the brain. The significance of these changes is still unknown, but they may eventually aid in determining causes. Chemistry of the brain. Neurotransmitters are naturally occurring brain chemicals that are thought to be involved in depression. According to recent research, changes in the function and effect of these neurotransmitters, as well as how they interact with neurocircuits involved in mood stability, may play a significant role in depression and its treatment. Hormones. Changes in the body's hormone balance may play a role in causing or triggering depression. Hormone changes can occur during pregnancy and in the weeks or months following delivery, postpartum, as well as a result of thyroid problems, menopause, or a variety of other conditions. Traits that are inherited. Depression is more common in people whose blood relatives suffer from it. Researchers are looking for genes that may be involved in the development of depression. Risk elements of depression. Depression typically begins in the teen, 20s, or 30s, but it can occur at any age. Women are diagnosed with depression at a higher rate than men, but this may be due in part to women being more likely to seek treatment. The following factors appear to increase the risk of developing or triggering depression. Certain personality traits, such as low self-esteem and being overly dependent, self-critical, or pessimistic, should be avoided. Physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial difficulties are all examples of traumatic or stressful events. Family members who have a history of depression, bipolar disorder, alcoholism, or suicide. Being lesbian, gay, bisexual, or transgender, or having genital organ development differences that aren't clearly male or female. Being lesbian, gay, bisexual, or transgender in an unsupportive environment, or having variations in the development of genital organs that aren't clearly male or female, intersex. Other mental health disorders, such as anxiety disorder, eating disorders, or post-traumatic stress disorder, have history. Alcohol or recreational drug use. Cancer, stroke, chronic pain, or heart disease are examples of serious or chronic illnesses. Certain medications, such as blood pressure medications and sleeping pills, talk to your doctor before stopping any medication. Complications. Depression is a serious illness that can have devastating consequences for you and your family. If depression is not treated, it often worsens, resulting in emotional, behavioral, and health issues that affect every aspect of your life. Examples of depression-related complications include obesity or excess weight, which can lead to heart disease and diabetes, physical ailment or pain, misuse of alcohol or drugs, anxiety, panic disorder, or social phobia are all examples of anxiety disorders. Conflicts in family, difficulties in relationships, and issues at work or school. Social isolation, suicidal thoughts, attempts, or suicide. Premature death due to medical conditions, such as self-mutilation. Prevention. There is no surefire way to avoid depression. However, these strategies may be beneficial. Take steps to reduce stress, build resilience, and boost your self-esteem. Reach out to family and friends for support, especially during times of crisis. To help prevent depression from worsening, seek treatment as soon as you notice a problem. Consider getting long-term maintenance treatment to help prevent symptoms from returning.